Hi guys. So today we are going to talk about the pharmacology, adverse drug reactions. So let's begin. I guess this is the most tough topic of the pharmacology because the drugs reactions are very difficult to memorize the things. So let's begin. So adverse drug reactions. Most drugs produce several effects, but usually one effect, the therapeutic effects, is wanted for the treatment of a disorder. Okay. In addition, a drug may also elicit unwanted effects that in turn may cause complaints, provoke illness, or even lead to death. One sec, guys. So, okay. So, definition of adverse drug reactions. Adverse drug effect is a broad term referring to unwanted, uncomfortable, or dangerous effect that a drug may have. Okay. So, side effect is an impressive term often used to refer a drug's unintended effects that occur within the therapeutic effect range. Risk factors for adverse drug reactions. Many factors can increase the likelihood of an adverse drug reaction. They include simultaneous use of several drugs, very young or old age, incidence is higher with advanced age and polypharmacy, pregnancy, breastfeeding, hereditary factors, certain diseases, adverse effects are sometimes referred to as iatrogenic because they are caused by physician or treatment. Now, statistics. Adverse drug reactions occur in 10 to 20% of hospitalization. About 10 to 20% of these reactions are severe. About 3% to 7% of all hospital admissions in the US are for treatment of adverse drug reactions. Okay. The incidence of severe or fatal adverse drug reaction is very low, typically one in less than one in thousand people. Adverse drug reactions may not be drug apparent during clinical trials. Okay, during ADRs thus ADRs may not be seen until after a drug is released to the general public and is in widespread use. Okay. Clinicians should not assume that because a drug is on the market that all ADRs are known. Okay, post-marketing surveillance is extremely important for tracing low incidence ADRs. Okay, post-marketing surveillance is extremely important for the tracking low incidence ADRs. Okay, so symptoms and signs. Adverse drug reactions are usually classified as mild, moderate, or severe or lethal. Mild adverse drug reaction digestive disturbances, loss of appetite, nausea, a bloating sensation, constipation, and diarrhea are particularly common adverse drug reactions because most drugs are taken by the mouth and pass through the digestive tract. However, almost any organ system can be affected. In older people, the brain is commonly affected, often resulting in drowsiness and confusion. Okay, so in the mild adverse drug reactions, we have digestive disturbances, which include the loss of appetite, nausea, constipation, and diarrhea. Okay, uh, and because the drugs are taken by the mouth and pass through the digestive tract, they occur there nausea, loss of appetite, bloating sensation, constitution. Okay. The In older people, the brain is commonly affected, often resulting in drowsiness and confusion. Okay. So, moderate adverse reactions include the rashes, visual disturbances, muscle tremor, difficulty with urination, a common effect of many drugs in older women, any older men, sorry, older men. Okay, any perceptible change in mood or mental function, certain changes in blood components like temporary reversible decrease in white blood cells count or in blood levels of some substances like glucose. Now, severe adverse drug reactions. Severe reactions include those that may be life-threatening, like liver failure, abnormal heart rhythms, certain types of allergic reactions. Severe reactions can are relatively rare. People who develop a severe reaction usually must stop using the drug and must be treated. Doctors use every possible means to control a severe adverse drug reaction. Fine. So types of adverse effects. Okay, so we have three types of drug reactions: mild, moderate, and severe. So now the types of adverse effects. So adverse drug reactions are dose related and dose unrelated. Okay, so dose unrelated include the allergic, idiosyncratic, and pseudo allergic. Okay, those related ADRs include are usually predictable. ADRs unrelated to those are usually unpredictable. Okay, so when we give a drug to a patient, there is a particular dose associated with it. Okay, so effects that are caused when we give excess amount of drug is it is dose related. Like we give improper dose to the patient, but in the dose unrelated as like allergy, idiosyncratic or pseudo allergic, we can predict the outcome of the disease of the drug. Okay, so or research, dose related adverse drug reaction may occur if a drug dose is too high. Overdose reaction. When the drug is administered in a higher dose than is required for the principal effect, this directly or indirectly affects other body functions. For example, a person taking a drug insulin or an oral anti-diabetic drug that reduces the blood sugar level too much may develop weakness, sweating, nausea, and palpitations, even brain edema, cardiac glycosides, cardiac blockades, asystole. Okay, so dose-related ADRs are particularly a concern when drugs have a narrow therapeutic index. Now, what is this therapeutic index? So, therapeutic index it basically shows the difference in the minimum toxic effect of the drug and the minimum therapeutic effect of the drug. Like when we give a drug to a patient. Okay, so for example, we will take an example of theophylline. Theophylline is a drug. Okay, so if we give the patient above 80 milligrams of drug per liter, then it causes toxic effect in the body. Okay, and if we give 8 milligrams of drug to the patient, then it is considered beneficial because it does not produce any toxic effects. Okay, so yeah, it does not produce any toxic effects. So the therapeutic index of this theophylline drug is about 8 mg to 18 mg. Okay, and this is very short. Okay, so the safety of the drug is not very nice in this case. Like in case of hemorrhage with oral anticoagulants. For example, morphine given in appropriate dose afford excellent pain relief. Okay. However, in excess doses, it inhibits the respiratory center of and makes apnea imminent. Imminent. Okay. Difference between the therapeutic and toxic dose margin. See, difference between the therapeutic and toxic dose margin of safety or therapeutic indicates the risk of toxicity when standard doses are exceeded. Drug allergy. This is a drug non dose unrelated. Okay. Allergic areas are not dose area. Allergies develop when a drug acts as an allergen or antigen. Allergic reactions occur when the body's immune system develops an inappropriate reaction to a drug. Immune system normally functions to inactivate and remove for high molecular weight foreign matter taken up by the organism. Okay. Typically, allergy occurs when the drug is given after an initial exposure. After a person is sensitized, later exposures to the drug produce one of the several different types of allergic reactions. Sometimes the doctors do the skin test to help predict the allergic drug reactions. Okay. Drug allergy with penicillin G during initial contact, immune system is sensitized. Lymphocytes of T cells and B cell proliferate in the lymphatic tissue, and the greater the amount of antibody immunoglobulin produces. Usually, this process remain clinically silent. Okay. During the second contact, antibodies are already present and the memory cells proliferate rapidly. A detectable immune response occur, the allergic reactions. Okay. This can be of severe intensity even at a low dose of antigen. Okay. So, four types of allergic reaction can be distinguished. Type 1, immediate drug allergy, anaphylactic reactions. Drug-specific antibodies of IgE type localized on the surface of mast cells. Subsequent binding of the drug provides the stimulus for the mast cell degranulation with release of histamine and other allergic mediator prostaglandins and leukotrienes. These endogenous substances, autocoids, mediate a wide range of cellular responses, including contraction of airways, smooth muscle, stimulation of secretion, dilation, and increased permeability of the capillary and stimulation of sensory nerve endings. Okay, so let's take an example to understand this type 1 immediate drug allergy or anaphylactic shock. So let's take an example of asthma, bronchial asthma. Uh, um, Specifically speaking of bronchial asthma. So when an allergen comes in the bronchus, okay, it triggers the release of IgE molecule from the mast cells. No, not from mast cells, from plasma cells. Actually, the plasma cells are the differentiated form of B cells. Okay, so plasma cells they release antibodies, mainly the IgE type, and on mast cells there are the receptors for the IgE molecule. Okay, these are called as Fc epsilon R1 receptor. What did I say? The mast cells have a receptor for the IgE antibody. These are called as the Fc epsilon R1 receptor. Okay, so IgE molecule bind to this receptor and causes the degranulation of the mast cell and releasing the histamine and other allergic mediators, mainly prostaglandins and leukotrienes. Okay, so now, what does histamine do? Histamine acts on the H1 receptors on the bronchus and causes the bronchoconstriction, and in the blood vessel it causes the vasodilation. Okay, in bronchus it causes bronchoconstriction, and in the blood vessel it causes vasodilation. Okay, so, okay, simulation of secretion diet. Okay, fine. So, in most severe form, of life-threatening anaphylactic shock accompanied by hypotension, bronchospasm, asthma attack, laryngeal edema, urticaria, stimulation of gut musculature, and spontaneous bowel movements. Type 2 cytotoxic reactions. Drug antibody IgG complexes adhere to the surface of blood cells and activate the complement, and finally can destroy the cell membrane and thereby cause cell death. Type 2 reactions include hemolytic anemia from methyl-dopa, lupus erythematosus, okay, from hydrolyzing or procainamide, and etc. Okay. So what happens in the type 2 cytotoxic reaction is that the drug antibody, like mainly predominantly the antibody of type IgG, immunoglobulin G, is involved in the type 2 cytotoxic reactions. Okay, and it activates the complement is a series of proteins produced by the liver. Okay, so these are very important for the for killing of bacteria by producing of membrane attack complex. Okay, and thereby cause cell death. Okay, type 2 reactions in the examples of the type 2 hypersensitivity reaction are the hemolytic anemia from methyl dopa, lupus erythematosus from hydrolyzin or procainamide, and etc. Okay, now type 3 immune complex vasculitis. Immune complex. Or so in this case, what happens that there is formation of antigen antibody complexes. Okay, antigen antibody complexes form. Okay, examples are serum sickness and arthritis reaction. Drug antibody complexes that involve IgG, IgM, and possibly IgE antibodies precipitate on vascular walls. Complement is activated and an inflammatory reaction is triggered. Okay. Now, symptoms of may include fever, exanthema, swelling of lymph nodes, arthritis, nephritis, and neuropathy. Steven-Johnson syndrome associated with the sulfonamide therapy may result from type 3 mechanisms. Okay. Type 4. Now, type 4 allergy is a cell-mediated reaction that can occur from topical application of drugs. It results in a contract dermatitis. Okay. So, what I mean in type 4 is also called as a delayed type of a hypersensitivity. Why? Because this allergic reaction requires some time to develop, like 12 hours to 24 hours it requires. Okay, and and this type of hy- and this type of allergy is caused by the topical application of drugs. Okay, and the complications of this allergy are the contact dermatitis. So, treatment of allergy, a mild reaction may be treated with the antihistamine. Okay, a severe or life-threatening reaction may require an injection of epinephrine. Epinephrine, also called as a adrenaline, or a corticosteroid like hydrocortisone. So, idiosyncratic ADRs. The ADRs is the adverse drug reactions. So, idiosyncratic ADRs are not they are not dose related or allergic. Hemolytic anemia to salicylates caused by glucose 6 phosphate deficiency. These reactions typically occur in a very small number of people. Idiosyncrasy is defined as a genetically determined abnormal response to a drug. Okay. Examples of such adverse drug reactions include rashes, jaundice, anemia, a decrease in white blood cell count, kidney damage, and nerve injury that may impair vision or hearing. Increased sensitivity. If certain body functions develops hyperreactivity, unwanted effects can occur even at normal dose levels. For instance, aspirin provokes a bronchial asthma attack. ठीक है. So, non specificity, undesired effect can occur because the drug does not uh, un- act on does not act on the targeted disease tissue or organ. For instance, the the neuroleptic clo- chlorpromazine is able to interact with several different receptor types. Thus, its action is neither organ specific nor receptor receptor nor receptor. Okay. Unknown action. It is more difficult to detect adverse effects that arise from an unknown action. For instance, fetal damage after intake of after intake of a hypnotic thalidomide, fibrosis after anti-migraine drugs. Remember, with every drug use, unwanted effects must be taken into account. All drugs have the potential for adverse drug reactions. There is risk benefit analysis. Analyzing the likelihood of benefit versus risk of ADRs is is necessary whenever a drug is prescribed. Cutaneous reactions. So, cutaneous reactions are a common form of drug adverse reaction. They vary from harmless to lethal. For instance, these are Steven-Johnson's syndrome (SJS), erythema multiforme, and toxic epidermal necrolysis (10) or Yell syndrome with apoptosis of keratinocytes and bullous detachment of epidermis from dermis. Course of these symptoms is dramatic and outcome may not really fatal. Okay. Mentioned reactions result from the use of penicillins and sulfonamides. Lel syndrome is more severe and lethality is 40%. Even in current even in the current clinical conditions. Man, 65 years old, breast cancer. The tumor is induced by the therapeutic doses of a synthetic estrogen. Toxicity in pregnancy and lactation and breastfeeding. Drugs taken by mother can be passed or placentally or via breast milk and can adversely affect the unborn or neonate pregnancy. Any type of therapy, among them even vitamin therapy during pregnancy and the neonatal period requires special considerations. Drug toxicity in pregnancy and lactation. Many drugs, for example, antihypertensive drugs like angiotensin-converting enzyme (ACE) inhibitors and angiotensin 2 receptor blockers (ARBs), pose a risk for health and normal development of fetus. Toxicity in pregnancy and lactation. To the extent possible, pregnant women should not take any drugs, especially during the first trimester. Use of any prescription drugs, over-the-counter drugs, and dietary supplements, including medicinal herbs, during pregnancy requires a doctor's supervision. Okay. Adverse drug reaction in children. Infants and very young children are at high risk of adverse drug reactions because their capacity to metabolize drugs is not fully developed. For example, newborns cannot metabolize and eliminate the antibiotic chloramphenicol. Newborns who are given the drug may develop gray baby syndrome or serious and often fatal reaction. Effort Tetracycline, another antibody, is given to infants and young children during the period when their teeth are being formed up to about age 8. It may permanently discolor tooth enamel. Tetracyclines cause tooth enamel dysplasia and inhibition of bone growth. Children under age 18 are at risk of Reye syndrome if they are given aspirin while they have influenza or chickenpox. Aminoglycosides, example gentamicin, may cause neurologic damage. Among them is auditory nerve damage. Sulfonamides by displacing bilirubin from serum albumin may cause uh, carni- kernicterus in neonate. Okay. The fluoroquinolones are not recommended for use in pregnancy or in small children because of possible effects on growing cartilage. A peculiar type of damage results from the synthetic estrogen agent diethyl stilbestrol following its use during pregnancy. Daughters of treated mothers have an daughters of treated mothers have an increased incidence of cervical and vaginal carcinoma at the age of 20 years. Teratogenic effects. Teratogenic effects, physical temperature, radiation, chemical, drugs, biological, viruses, or bacteria, agents that causes fetal damage in teratologic determination period. Teratologic determination period, the period in which a teratogenic agent must act in the sensitive phase of organ or tissue development in order to cause a certain pattern of injury. The causative agent may be either an intrinsic, that is genetic factor, or an extrinsic, that is environmental factors. Embryopathy, deformity resulting from disturbances of embryo development during the third eighth week of third trimester or the eighth week of pregnancy. Oh no. Embryopathy is a deformity resulting from the disturbances of embryonic development during the third to eighth week of pregnancy. Okay, third to eighth week of pregnancy, embryopathy. Fetopathy, deformity resulting from disturbances of fetal development from the ninth week of pregnancy until birth. Embryotoxic and fetotoxic injury. Any exogenous disturbances ranging from irreversible injury to lethal injury. Drugs and medicinal herbs may be transmitted through breast milk to an infant. Some drugs should not be taken by women who are breastfeeding, whereas others can be taken but require a doctor's supervision. Teratogenic effects of carbamazepine in pregnancy that induces the folic acid metabolism. Thalidomide embryopathy, a typical malformation syndrome primarily occurring in the form of limb abnormalities following intake of thalidomide in the pregnancy. Schistocelia, orofacial pathology, and disturbances of fetal ligaments, spina bifida, anencephaly, and encephalocele. Adverse drug reaction in elderly patients. Older people are at higher risk of having an adverse drug reaction for several reasons. They are likely to have many health problems and thus to be taking several prescription and over-the-counter drugs. Also, as people age, the liver is less able to metabolize many drugs, and the kidneys are less able to eliminate drugs from the body, increasing the risk of kidney damage by a drug and other adverse drug reactions. Most drugs have a large list of adverse effects. Examples with specific medications. Abortion, uterine hemorrhage associated with misoprostol, cytotic, a liver-inducing drug. This is a case where the adverse effect has been used legally and illegally for performing abortions. Oh, okay. Misoprostol. Cytotic. It is a drug which is used to to prevent abortions, to cause abortions. See, okay. Addiction to many sedatives and analgesics like diazepam and morphine, both differ associated with the thalidomide. Cardiovascular disease associated with COX2 inhibitors, cyclooxygenase 2 inhibitors, deafness and kidney failure associated with gentamicin and antibiotic, bleeding of intestine associated with aspirin therapy, hematomas caused by warfarin heparin, Cushing syndrome caused by glucocorticosteroids, glucocorticosteroids, gynecomastia caused by cimetidine, nasal septum perforation caused by cocaine, OHS, ovarian hyperstimulation syndrome caused by clomiphene, glaucoma and cataract associated with the corticosteroid based eye drop tablet solution, glaucoma and cataract. Examples with the specific medication death following sedation in children using propofol, depression or hepatic injury caused by interferon, diabetes caused by atypical antipsychotic medication, neuroleptic psychiatric drugs, erectile dysfunction associated with many drugs like antidepressants, fever associated with vaccination, hair loss and anemia may be caused by chemotherapy against cancer, leukemia, headache following spinal anesthesia, hypertension in ephedrine users. Lactic acidosis with the use of strividine, Zerit for HIV therapy, or metformin for diabetes. Mania caused by corticosteroids. Liver damage from paracetamol. What the fuck? Liver damage from paracetamol. मेंशन मतलब अपन जो टैबलेट खाते पैरासिटामोल वो अभी तक भी हमारे लिवर को डैमेज जो क्या है ये? Melasma and thrombosis with the use of estrogen containing hormone contraceptions like combined oral contraceptive pill, rhabdomyolysis with statins and anti-cholesterol drugs, seizures caused by withdrawal from benzodiazepines, drowsiness or increase in appetite due to antihistamine use. Some antihistamines are used in sleep aids ex- explicitly because they cause drowsiness. stroke or heart attack like with s- sildenafil Viagra when used with nitroglycerin. Suicide increase tendency with the use of fluoxetine and other selective serotonin reuptake inhibitor SSRI antidepressants. Tardive dyskinesia with the use of meto, metoclopramide and many antipsychotic medications. Okay, guys. So, we have officially finished the topic. Bye bye.